you have been looking at acute lymphoblastic leukemia, and this is patients with refractory or relapsing disease who may well have already received a couple of TKIs, a couple of different ones, and they are very poor prognosis. What were you trying to do with them? What was the big issue you were looking at here?
Yes, this is a very rare population and a very rare disease, the Ph positive acute lymphoblastic leukemia. But they are very important because in the last years there was an emerging treatment with TKI, which is a tyrosine kinase inhibitor of second or third generation, giving very important results. However, a majority of these patients relapse frequently, particularly in the elderly population, and they have no chance to get additional treatment. And the prognosis is still poor in the majority of these patients.
Now, you've been using Blinatumomab, which is a BiTE. It's a special kind of TKI, and it's a bispecific T-cell engaging antibody. What does that mean?
Is a new compound, very emerging, very new in the concept. Is a molecule that binds the effector of response, T-cell killing response against leukemia, and this makes drive the leukemic effect, anti-leukemic effect of our T cells against the blast CD90 positive. So it's a sort of restoring immunocompetence in our body. That's a very promising approach.
It sounds a very interesting idea. What did you do in the study?
We studied 45 patients with Ph positive refractory relapsed patients, mostly of them very aged, to the blinatumomab. It's a continuous infusion of this compound for 24 hours, for 28 days. So continuous infusion, the patients stay for a long time with this drug in a very small amounts of drugs infusion. And they restore the activity against leukemia. So it's a sort of re-emerging of our autoimmunity against cancer in our body. They respond very well. We get 45% response in the majority of the patients. 35 of this was complete hematological response, and 88 of this population, almost all the patients, has a very deep molecular response, which means that they respond very well.
What might this mean then in clinical terms? It's a relatively rare group of patients, but how might clinicians think about applying a drug like Blinatumomab?
It is not clear until now because the advantage is enormous in the majority of the patients. But we don't know how much enormous will be or can be in this sort of patient. The majority of these patients has no transplant procedures opportunity. So these drugs means that they have possibility to be cured without transplantation and without chemo. That is absolutely a new entry in the majority of the population over 55 years old. The majority of the patients can probably be cured without chemo and without transplantation. We don't know really what's happening when you use this drug up front because this was a relapsed refractory population. But however, this could be very emerging new compound for this poor population, for our heroic patients.
Right, now in this setting of refractory and relapsing ALL, could you give me some kind of picture? Could you paint a picture of with the drug or without the drug? How big a difference? You said cure there.
Yeah, it could be important because if we will be able to obtain a complete response in the majority of the patients, we can avoid to transplant. And we know that we get a tremendous power with the second generation, third generation TKI. The combination of this drug to the second generation, third generation TKI will be very useful in the majority of the patients in the future.
So what should doctors be making of your results right now?
I think the majority of the patients has to take care this opportunity for the patient relapsed and refractory in Ph positive acute lymphoblastic leukemia.
And the take-home message about Blinatumomab in ALL in this severe patient group?
Yeah, the message is that this is probably not a promise, but is a certain in this moment for the majority of the acute lymphoblastic leukemia population.